thanks, everybody. This has been an amazing day, I'm told, and I'm just delighted that we've had the opportunity to talk about youth and focus on prevention, as well as I just heard, recovery and treatment. And, this is the fourth forum that we've had, and every time we meet, we learn something new. This particular discussion today, as I understand, is going to be broadcast repeatedly around the country at some of the coalition meetings, as more and more of our coalitions are getting into the issues, not just of education and prevention, but also treatment and recovery, and I'm delighted about that as well. I also think this gives us some momentum with regard to CARA, and I thank you for your support of that legislation, which is the comprehensive approach looking at, again, education and prevention and right through treatment and recovery. We have a separate bill that is about to be introduced that I know many of you are very interested in, and that is the Reauthorization of the Drug-Free Communities Act. And as was noted, I was the author of that back in the House days, and at the time we thought, this is probably worth trying because it's so important to focus on keeping people out of the funnel of addiction. And it's the most cost-effective way. It's incredibly important to try to focus on what works in this area, and coalitions seem to be working. We had no idea how successful it would be, to be honest with you, because I think it's true now, and General Dean or Sue Thaw, who's here somewhere, can correct me, but I think we've now supported 2,000 community coalitions around the country. And thank you. And over 9,000 volunteers have been engaged through that. And so, it has worked, and we have to be sure as we reauthorize this program that we improve it, streamline it, so your input is very important. My understanding is that Senator Grassley, Senator Leahy, Senator Feinstein are all interested in this reauthorization, which is really important because that's the Judiciary Committee will be the key committee. And so I'm looking forward to continuing to work with them and with you to put together the best reauthorization possible. And we hope to introduce it very shortly. So I thank you in advance for what you will do, both to be sure we have the input, but also to encourage that legislation moving forward. There is always more to do, and right now in my own state of Ohio, we have an increase in not just opiate use, but specifically heroin use. And this morning I was with nurses who are working in emergency rooms in Ohio, and they came to talk to me about their policy issues, but what they really wanted to talk about was the number of people who are showing up in the emergency rooms. And these are people who are addicted, people who have lost hope, many return patients. In other words, they're seeing people again and again. And their question to me was, what are you all doing to help with regard to this issue of increasing drug addiction in our my home state of Ohio? And it reminded me of I'm going to date myself here, 21 years ago, 21 years ago, being in the House of Representatives and having a constituent come to me and said the same thing that these women said to me this morning. And in her case, it was about her son who had just died of an overdose of huffing gasoline and smoking marijuana. And she said, "What are you doing?" And I said, being fully briefed by my wonderful staff, I said, well, we have the answer. We're spending $15 billion a year on prosecutions, on intervention, on eradication of drugs in countries like Colombia, supply side, supply side, supply side, and law enforcement. And she kind of looked at me and said, well, how's that going to help me in my community? Our church is in denial. It says it's not a problem here. They won't get involved. I called a meeting of parents. No one showed up. The school doesn't want to get engaged because they don't want it to be on their report card. And that's how we really launched this community coalition effort, is to say, how can you help this mom who has just lost a son? She had another son. The son she lost, Jeffrey Gardner, I still have his gold ID bracelet that I keep, but her other son is doing great. But she was, of course, very worried about him following in his older brother's footsteps. So it's a difficult task because prevention and education is something that, frankly, we don't have the best science on. although it's much better now, and the evidence-based work that this group has done and others is very important, and that's one of our, as you know, prime focus of the Drug-Free Communities Act is to ensure we are using evidence. And in Cincinnati, every 2 years, I chaired our coalition there. I founded it and chaired it for 9 years, but every 2 years we do almost, it's a survey, and it's hundreds, tens of thousands of students. So it's not just sort of a poll, it's a real survey, and we try to use that evidence to come up with better strategies, but there's more work to be done there, isn't there? And it's a challenge. And then on prevention and education, it's always a challenge to find the funding. And that's why, again, Drug-Free Communities Act is so important, because it's matching funding. On prevention and treatment, I know there was discussion about some of our colleges and universities. At The Ohio State University, we have, as of, I think about a year and a half ago now, a group of recovering addicts who have come together and formed a support group. And first time ever at the largest university campus in America. I'm sorry it took so long, but I'm so grateful for the courageous individuals who started that group, and we need to support them. But recovery is obviously full of challenges too, and we need better information. We need, better medication, frankly. We need to understand better what works and what doesn't work. So this group, again, is very important in that regard. We can never, ever give up. And, there's lots of reasons for that. It has to do with our economy. It has to do with jobs. I went to a factory in Ohio recently where half the people who applied for a job couldn't pass a drug test. But it's really about the devastation to families and communities. And it's really about letting people achieve their God-given abilities and giving them the support to be able to do that. And so the Jeff Gardners of the future have a chance to pursue their dreams, and that's what you're doing. So it's a noble undertaking. It's not easy, and there are plenty of challenges along the way, but we need your advice and counsel, and we need to get CARA moving. I'm not sure we'll be able to move the entire package, but I'm for doing whatever we can. And my sense is the Judiciary Committee is now looking carefully at that, in part because of these fora and our ability to explain the issues as you go around to offices. I know some of you are involved with that effort right now. And then with the Drug-Free Communities Act, I think there's a chance for us to improve it, to reauthorize it, so that every year in the appropriations process I don't get this question, well, you don't have an authorization. How much should we appropriate? Is it really working? These authorizations are key, particularly in a time of increasing pressures on the discretionary budget. So thank you so much for what you have done and will do. And for those who wonder, are you making a difference? Absolutely. Absolutely. And when I'm home and I meet people who are in recovery, or I meet people who are young people willing to stand up, in high school with peers who sometimes apply pressure to them and say, this does make a difference. I'm willing to stand up. That is what ultimately is going to solve this problem. Not Washington, D.C., but Washington, D.C. helping at the local level for those folks. So there's a story about the kid who's on the beach, and he's got hundreds of thousands of starfish that have washed up, and some of you have seen this before on beaches where this happens, and the kid is throwing starfish back in the ocean, and the old man comes up to him and says, "What are you doing? You can't save all these starfish. You're wasting your time." And he picks up the starfish, throws it in the ocean, and he says, "I saved that one." So that's what we're doing, and we will continue to do it because we do care ultimately about people having this ability to lead productive lives and to achieve their God-given abilities. Thank you all.